If you're over 60 and taking amlodipine, your body might be sending you signals right now. Swollen feet that won't go down. Dizziness when you stand up too fast. A tiredness that sleep doesn't fix. Changes in your vision that you've been blaming on age. And a heartbeat that sometimes feels off. These are the 5 warning signs, and they may not be aging at all. I'm Ellis. I do the research so you don't have to. And here's what most people don't realize. Amlodipine is the most prescribed blood pressure medication in the United States. Over 70 million prescriptions every single year. But the side effects? Most patients are told almost nothing about them. By the end of this video, you'll know exactly what to look for, why these symptoms happen, and what the research actually says about what you can do. Stay with me, because warning sign number 3 is the one that surprises almost everyone. Now, let me be clear about something. I am not a doctor, and this video is not medical advice. What I am is someone who reads the research, the clinical trials, the meta-analyses, the drug safety data that your doctor might not have time to dig through between 15-minute appointments. Because here's the thing about amlodipine. It was approved by the FDA in 1992, over 30 years ago. Since then, millions of people have taken it. That means we have decades of real-world data on what happens, not just in controlled trials, but in actual bodies over actual years. Some of that data is surprising. Some of it fills in the gaps your doctor may not have mentioned, and all of it matters if you're the one taking this medication every morning. Before we get into the 5 warning signs, I need you to think about your body differently for a moment. Think about your car. When the check engine light comes on, you don't ignore it and hope it goes away. You don't say, well, the car is getting older. These things happen. You pay attention because that light is telling you something specific. Your body works the same way. Symptoms are not random. They are not just aging. They are signals. Your body is communicating with you, and it's remarkably precise about it. The swelling in your ankles? That's not your body saying, I'm old now. That's your body responding to a specific mechanism. And with amlodipine, we know exactly what that mechanism is. And here's where things get interesting. Amlodipine is a calcium channel blocker. That's the category. What it does is relax and widen your blood vessels. That's how it lowers blood pressure. Less resistance in the pipes means lower pressure. But here's what many patients are never told. That same mechanism, the widening of blood vessels, is exactly what causes several of the warning signs we're about to discuss. Your blood vessels don't just widen where you want them to. They widen everywhere. In your feet, in your brain, in the tiny vessels behind your eyes. And that changes everything. The question isn't whether amlodipine works. It works. Millions of people have avoided strokes and heart attacks because of this medication. The question is whether you're experiencing side effects that deserve attention, and whether there are evidence-based steps you can take. That's what we're covering today. Number 1, swelling in your feet and ankles. This is the most common side effect. If you're on amlodipine and your shoes feel tighter at the end of the day, you're not imagining it. Research shows that peripheral edema, that's the medical term for swelling in the lower legs, affects roughly 10 to 25% of people taking amlodipine. Some studies put that number even higher at higher doses. Here's why it happens. Remember how amlodipine widens your blood vessels? When those vessels widen, they become more permeable. Fluid leaks out of the capillaries and pools in the surrounding tissue. And because of gravity, it pools in the lowest point, your feet and ankles. Think of it like a garden hose with tiny holes in it. When the water pressure drops, water doesn't spray out, it drips. That's what's happening in your legs. Now, here's something most videos skip entirely, the timeline. When you first start amlodipine, week 1, week 2, some puffiness in your feet and ankles is common. Your body is adjusting to the medication. Mild swelling that goes down overnight, that's not unusual. That's not necessarily a problem. But here's the part that matters. By the end of the first month, your body should have stabilized. The swelling may not disappear completely, but it shouldn't be getting worse. If you're at month 2 or month 3 and your shoes are getting tighter, not looser, that's not just the amlodipine adjusting. That's a signal that your body's not tolerating this dose well. And the timeline tells your doctor something specific. It started mild, but it's getting worse over 3 months is a completely different conversation than I just started and my feet are a little puffy. One says adjustment period. The other says this dose may not be right for you. Now here's where it gets dangerous. Most doctors will tell you ankle swelling from amlodipine is benign. And for many people it is. Uncomfortable, but not dangerous. But if you have heart failure, even mild heart failure you may not know about, that swelling can be a sign that fluid is building up in places you cannot see. The research is clear. If the swelling is only in one leg, or if it comes with shortness of breath, or if pressing on it leaves a deep dent that takes time to bounce back, those are not just amlodipine. Those require a conversation with your doctor. Soon. What can you do about it? The research supports a few things. Elevating your legs above heart level for 20 minutes, 2 or 3 times a day. Reducing salt, and I mean really reducing it, not just putting down the salt shaker. Compression stockings help some people. But here's what the research also shows. If the swelling is severe, lowering the dose, with your doctor's guidance, often reduce the swelling significantly without losing much blood pressure control. One study in the Journal of Hypertension found that going from 10 milligrams to 5 milligrams reduced edema rates by nearly half, while maintaining most of the benefit. That's a conversation worth having. Number 2, dizziness and lightheadedness, especially when you stand up. This one is sneaky, because dizziness after 60, that's easy to dismiss. I stood up too fast. I must be dehydrated. It's probably an inner ear thing. And sometimes it is those things. But amlodipine can cause what's called orthostatic hypotension. That's a drop in blood pressure when you move from sitting to standing. Your blood vessels are already relaxed from the medication. When you stand up, gravity pulls blood downward, and your vessels don't constrict quickly enough to push it back up to your brain. The result? A few seconds of dizziness, sometimes blurred vision, sometimes feeling like you might pass out. Here's the number that matters. Studies show that seniors who experience orthostatic hypotension have a significantly higher risk of falls, and falls after 65. They're not just bumps and bruises. They're one of the leading causes of serious injury and loss of independence. So what do? First, stand up slowly. I know that sounds simple, almost too simple, but giving your blood vessels an extra 5 seconds to adjust makes a real difference. Second, hydration matters more than you think. Amlodipine's effect is more pronounced when you're dehydrated. And third, if this happens regularly, not once a month, but several times a week, tell your doctor. Don't mention it in passing. Don't say, I get a little dizzy sometimes. Be specific. When I stand up from my recliner, I get dizzy for about 10 seconds. It happens most afternoons. That level of detail changes what your doctor can do about it. Number 3, fatigue and brain fog. This is the one I told you surprises almost everyone. Because here's what happens. You start taking amlodipine. Your blood pressure improves. That's good. But a few weeks in, you notice you're tired. Not sleepy. Tired. Like your get up and go got up and went. You chalk it up to age. Or maybe you think you're not sleeping well. Or you had a busy week. But the fatigue doesn't lift. And then you notice something else. Words don't come as easily. You walk into a room and forget why. Your thinking feels cloudy. Sound familiar? Here's what the research shows. Amlodipine crosses the blood-brain barrier. That's the protective filter that keeps most substances out of your brain. Amlodipine gets through, and when it does, it can affect the calcium channels in your brain cells. A review published in the journal Drug Safety examined central nervous system side effects of calcium channel blockers. Fatigue was consistently reported, so were dizziness and headache. But what's less discussed is the cognitive effect, the brain fog, that some patients describe as subtle but real. Now, let me be careful here. For most people, these effects are mild, and the benefit of controlled blood pressure, preventing stroke, protecting your kidneys, reducing heart attack risk, outweighs the fatigue. But here's what I want you to know. If the fatigue is affecting your quality of life, if you've stopped doing things you enjoy because you just don't have the energy, that's not something you have to accept silently. There are other blood pressure medications, ARBs, ACE inhibitors. Each works differently. Each has a different side effect profile. And sometimes, a conversation with your doctor about switching, not stopping but switching, can make a meaningful difference. Number 4, changes in your vision. This one is less common. But when I looked at what actual patients are asking about online, in forums, in comment sections, in support groups, vision changes came up over and over again. Blurred vision, increased sensitivity to light. In rare cases, floaters or flashes. And here's the gap. Most amlodipine information sheets mention visual disturbances as a possible side effect, but they rarely explain why. And when a senior mentions vision changes to their doctor, the conversation often goes straight to cataracts or macular degeneration, which are real, which are common, which deserve attention. But what if it's the medication? Here's what happens. Amlodipine dilates blood vessels, including the tiny vessels in your eyes, the ocular vasculature. When those vessels widen, it can change the pressure inside the eye. For most people, this causes nothing more than mild blurriness that comes and goes. But for people with glaucoma or elevated eye pressure, the effect can be more significant. And for people with diabetes, where eye health is already a concern, any additional vascular change deserves attention. Now, this is where it gets genuinely complex, because eye problems after 60 are common. Cataracts are common. Macular degeneration is common. Diabetic retinopathy is common. How do you know if it's the amlodipine or something else? You don't. Not on your own. What you can do is this. If you've noticed vision changes since starting amlodipine, especially if those changes started within the first few months, write down the timeline. When did the medication start? When did the vision change start? Bring that timeline to your eye doctor and your prescribing physician. Because here's the thing about medicine after 60. You're often seeing multiple specialists. Your cardiologist manages your blood pressure. Your ophthalmologist manages your eyes. And unless you connect the dots, neither one sees the full picture. You are the only person who connects those dots. Number 5, a heartbeat that feels different. Now let me be specific about this one, because heart palpitations covers a lot of ground. What some amlodipine users report is a faster heartbeat, especially at rest, or a sensation that their heart is pounding harder than it should be. Not necessarily faster, just harder, more noticeable. This is your body's compensation mechanism at work. When amlodipine drops your blood pressure, your body has a reflex response. It says, "Pressure's dropping. Let me speed things up to compensate." That's the sympathetic nervous system kicking in. The result can be a heart rate elevated by 5 to 10 beats per minute. For most people, this is harmless. Annoying, but harmless. But here's where it gets dangerous. If you already have an arrhythmia, an irregular heartbeat like atrial fibrillation, the combination can be more complicated. And if you're on amlodipine plus a beta blocker like metoprolol, the two medications can sometimes pull your heart rate in opposite directions. The research doesn't suggest that amlodipine causes dangerous arrhythmias in otherwise healthy hearts, but it can unmask or worsen existing ones. So what's the practical takeaway? Know your baseline. If you don't know your normal resting heart rate, check it. Sit quietly for 5 minutes. Count your pulse for 30 seconds and double it. That's your number. If you notice your heart rate consistently elevated by more than 10 to 15 beats above that baseline, especially with lightheadedness or shortness of breath, that's a conversation for your doctor. And one more thing. This is the warning sign you should never ignore. If your racing heartbeat comes with chest pain, severe shortness of breath, or feeling like you're about to pass out, do not wait for an appointment. That's an emergency room visit, period. Now let me show you 3 things that can make these side effects worse. And one of them is going to surprise you. First, grapefruit, specifically grapefruit juice. It interferes with how your liver processes amlodipine, which can increase the concentration of the drug in your blood. More drug in your system means more pronounced side effects. The research is clear on this. If you're on amlodipine, skip the grapefruit. Second, NSAIDs, ibuprofen, naproxen, the pain relievers millions of people take for arthritis and everyday aches. These can reduce how well amlodipine works and increase fluid retention. That means your blood pressure may not be as controlled as you think. And that ankle swelling might have 2 causes instead of 1. And third, this is the part nobody's talking about, stopping amlodipine suddenly. If you're frustrated with side effects, the temptation to just stop taking it is real. I understand that. You're the one living in your body. You're the one dealing with swollen feet and dizziness and fatigue day after day. But here's what the research shows. Stopping amlodipine abruptly can cause rebound hypertension. Your blood pressure can spike, sometimes higher than it was before you started the medication. In some cases, this spike can be dangerous. We're talking stroke level dangerous. This doesn't mean you're stuck with side effects forever. It means the conversation with your doctor is not optional. If you want to stop, reduce, or switch, do it with medical supervision, a taper plan, a monitored transition. You deserve relief from side effects, but you also deserve to be safe while getting it. Now, I want to pause and acknowledge something. Everything I've described today, the 5 warning signs, these are patterns. They're what the research shows across large groups of people. But your body is not a group average. Your situation is specific to you. Your dose, your other medications, your other health conditions, your age, your kidney function, your lifestyle. All of these things change the equation. So here's my honest guidance. If your situation is straightforward, you're on a low dose, your blood pressure is well controlled, and you're not experiencing any of these warning signs, you now have the knowledge you need. You know what to watch for. You're informed. But if you're experiencing one or more of these warning signs, especially if they're affecting your daily life, this is where it gets specific to your case. The next step is not a YouTube video. The next step is a conversation with your doctor, armed with the specific information you now have. Tell them which warning sign. Tell them when it started. Tell them how it affects your day. That level of detail gets a different response than, "I don't feel right." And if your doctor dismisses you, if you hear, "That's normal," without further discussion, here's what I want you to remember. You are the expert on your own body. The research is on your side, and asking for a medication review is not being difficult. It's being an informed patient. Small habits, repeated every day, including the habit of advocating for yourself. So here's what you now know. Amlodipine is an effective medication. It saves lives. But your body may send you signals: swelling, dizziness, fatigue, vision changes, heartbeat changes, and those signals deserve attention. You know what each one means. You know the research behind them. And most importantly, you know what to do next. The goal isn't to fear your medication, it's to understand it. Because healthy aging isn't one huge decision, it's hundreds of tiny ones, repeated every day. And being informed about what you put in your body every morning, that's one of the most important ones. If you found this helpful, please like and subscribe for more videos just like this one. I put in the research hours so you don't have to. I'm Ellis. Thanks for watching.